All right, congratulations to you. You've made it this far. You're nearly at the very end, and now you're here at arguably the most important part of the entire medical school process, the interview for residency. Briefly, a little bit about my experience. I interviewed twice, was in the match twice, was fortunate enough to match twice on my first attempts. I've interviewed in 2 different medical specialties. I've also been on some fellowship interviews, and I've also interviewed to be an attending and worked as an attending. So I've had a decent amount of interview experience, and over the past 2 or 3 years, this might be my 3rd year, I've been assisting to actually conduct some interviews for residents. So I do have somewhat of an insight, and I just want to help you guys out. So first and foremost, nothing changes when it comes to the dress code. Make sure you dress professionally. Make sure you use typical, elegant, professional looking colors. Today's not the day for you to shine by putting on a bow tie for men and using extravagant colors. Stick to what's classic and what works. You want the interviewer to not think about what you're wearing. Make sure everything is finely pressed and looks nice. But now here's the important part. How are you going to make sure it looks nice? Invest in quality audio and video. Of those 2, if for some reason you're not able to invest in proper equipment, audio is way more important. Make sure that the interviewer can hear you properly. If the video isn't so good, doesn't matter. As long as they can hear you properly, that's what matters the most. But you definitely need to invest in both high quality audio, high quality video. Practice with your friends on Zoom calls. Make sure the lighting is proper. Make sure that your friends can hear you properly. Make sure you're speaking properly. Oftentimes, the way that we speak when we're interacting with someone in person compared to when we're interacting with them through the screen is different. When you're enthusiastic about something, make sure that you are able to portray it. In the past, when things weren't virtual, you had other clues which said a lot for you, meaning your body language. Now, body language is less. Use your hands if you need to. Make sure you raise your voice, or you show enthusiasm through your face and your voice. These are the tips and tricks that you're going to definitely need to show the interviewer that you're enthusiastic. Number 2, so you finally made it this far, but remember, change your mentality. You've been through countless interviews for medical school. You showed everybody you're a fantastic student. You showed them what kind of research and what kind of work you can do, but now you're interviewing for employment. The whole point of this interview is to find out if you're likable, hardworking, not going to complain, and overall, you're going to be a very pleasant colleague to work with, because now that's what it is. You might be talking to these doctors who are hardcore trained veterans in years in the game, but they're going to be colleagues. You're going to be their colleague for the next X amount of years. So go in with that mentality. It's not really about how much studying you did. It's not really about how much research you did. Talk about those things if they bring them up. If the interviewer brings them up, talk about those things. But now it's all about you being a good colleague and good employee for them. So don't go in there with that mentality about, I had A's in X, Y, and Z, and that's it. No, all of that stuff, honestly, is irrelevant at this point. Number 3, remember that the same way that doing a virtual interview might be different for you, it's also different for them. They also don't have much experience with this. So you need to have one leg up on the rest of the competition. When you're speaking to the interviewer, look at the camera, don't look at the screen. That's the only way you'll be able to establish eye contact. Look at the camera of the interviewer. I would look at the camera of your device, because that's going to be you making eye contact with the interviewer. I can't underestimate how much of a difference that makes. Look at the actual camera, don't look at the screen, don't look around, don't have any other distractions, don't look down. Everyone's going to assume you're looking at your phone. Don't look at notes, don't keep notes on your lap for answers. All of this stuff is going to be very, very obvious. Look at the camera, make good eye contact, and smile. This is a very important time of your life. Even if you're not interested in the program, who are you to say where you're going to go? At the end of the day, you know that all residents, medical students, all potential residents, you're at the mercy of this algorithm, the match. We can talk about that in a different video. Show enthusiasm no matter which interview you go. And last, and might be the most important tip, do not ever put down any other medical specialty when they ask you the question about why you're interested in this particular specialty. I can't even tell you the amount of times that people have put answers or said things that put down other specialties, and literally, no matter what their credentials are, their application is gone. Do not ever put down any other medical specialty. talk about the good, positive points of this particular medical specialty, at the end of the day, all specialties in medicine work together. All of them we're all one unified body, essentially. We're just splitting up pathologies into different compartments, and so that everyone's an expert in different things. And at the end of the day, everyone is trying one goal: to help the patient. Do not ever put down any other specialty, ever. And one more bonus tip. Here's the bonus. Do not ever ask about the schedule. Don't ask about call. Don't ask about weekends. Don't ask about days off. Don't ask about vacations. No. You are a resident physician, okay? These doctors who are interviewing you worked way more hours than you're ever gonna work. They get really turned off when someone comes in asking about how often they're on call and asking details about the schedule. At the end of the day, no matter where you match, are you in a position to not follow that schedule? Whatever schedule they give you, they could put you on call beginning July 1st and for 3 years straight if you're doing some internal medicine residency. You have no say in any of that. So why is it any of your concern? No matter where you are gonna match, whatever your program is gonna expect of you is what you're gonna perform, because you're gonna want to graduate, and that's the only way you're gonna finish and complete the training. So do not, anytime these potential candidates ask about call and ask about these things, it makes you seem like you're lazy. It makes you seem like you're more concerned about the hours and clocking in and clocking out. Medicine is not that field. If you do feel that way, change that mentality quickly. You still have some time. But medicine is not that field. Just speak confident, short, coherent answers. Speak when spoken to, and enjoy the process. Enjoy this moment. Hope that helped. Best of luck on interview season.